Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, start. Tell me what's going on with your elbow. What happened? How did you injure it?
I have a throwing motion quite a few times a day. I lift heavy hay and I throw it, and so I've got some tendonitis going similar to like a tennis elbow or actually golfer's elbow.
How long has this been going on?
Off and on for a couple of years.
Couple of years. How much pain do you feel there from 0 to 10? And what caused the pain?
Using it aggravates the pain, and I'd say it's about a 5 out of 10.
What motion? You feel 5 now?
No, it's got to be lifting something, or if I'm poking it.
Let's get some weight. There's weight over there. So 5 pound or 4 pound?
I guess we'll see, but it feels different.
Let's get like 3 pound. I did I worked a little bit for demonstration. So yeah, we'll try the weight. And if someone can get the lotion, there's a lotion in the room here, or this room, big lotion. Okay, so this is 4 pounds, so let's do the motion and tell me how much pain.
Just holding it, it's about a 2.
About a 2, okay. Don't throw it on anyone.
No,
Everybody.
oh, that's interesting. That motion actually provokes a little pain more here than the elbow.
So what happened to your shoulder?
Oh, everything. Horse-related injury, fractured my second rib, went like this on my head. Multiple whiplashes and falls and breaks and
You want to work on the shoulder or the elbow?
Whatever
Don't
you
say both.
Whatever you
fine.
prefer.
You know, whatever like you feel it's actually worse.
Well,
so
if
we'll work on that.
Yeah. Well, if we're doing
0
this
to
right
10, how
now,
much?
that's like a 5.
5 in there, but this is not
It doesn't
too bad.
hurt the elbow right this moment.
Because we worked
Yeah.
for a little bit for demonstration. So, have you had any treatment for your elbow or your shoulder?
Not within the last year, probably.
But since that happened, did you have any treatment before?
Maybe a little here and there.
Okay.
I do have autoimmune disease to collagen
Okay.
and connective tissue
Okay.
disease and muscle tissue. So
Okay.
they all tend to be inflamed chronically.
Make sure what I'm doing is not painful.
I will tell you.
Okay. So I'm using the A1 now. Okay. I'm not gonna explain everything in detail. You guys are gonna understand because you took the class. Okay. You're taking the class now. This is the first day. So I'm actually starting with the same protocol I mentioned to you before. You know. Is that painful? It's okay.
It's good.
Okay, so you feel it right in here, yeah? When you did it, you felt it where? Right in here.
Yeah, maybe. Yeah, maybe this infraspinatus area.
Relax. Okay.
Yeah, there you go.
Oh, we found it. Okay, make sure this is not painful, okay?
It's a 1 or 2.
Okay. Relax. Is it too much or it's okay?
It's okay. I do harder to my patients.
Oh my goodness. I'm nice person. I used to do the hard stuff before, realize we can help them without being hard. Is that too much?
No, it's getting less painful as you go.
As I go? Okay. Do you feel the knot that I'm working on? Does it start to release or
It
not?
is.
Okay. So I palpate, and based on that I decided where to work on. And she was exactly on the point that I felt tension. And continue palpating, figure out where is the other area to release, make sure it's not painful.
It's a little painful.
Sorry.
It's okay.
Okay.
It's the only one.
Oh, okay. I'll use this
Make
one.
2.
I'm gonna use my hand.
Do you need lotion? I have
No.
some lotion.
That's fine. We might not need it, but we'll see if I can do it without it. think we have to do it like that. So,
Oh, don't film that area. No,
that-
just kidding.
okay, look the other way.
Yeah, I won't be able to watch it back.
Sorry.
You want some on there?
Can you imagine, but if all
Pour a little
disappeared
bit on
though,
there?
If
Yeah,
what?
that's
If
You let me
it's
know how
amazing.
much.
Yeah. Perfect.
you will watch it.
That's good. Okay, relax. Okay. You feel the tightness here?
Not really. That one
It's
doesn't
not
hurt
moving.
at all.
It's not
Yeah,
moving. You
okay.
feel that?
I believe it's not moving, yeah,
Yeah.
but it doesn't hurt.
Yeah, but if it stopped and I'm gonna release it. Okay, feel that now?
Better.
Okay.
Oh, it's a good tender spot there you got. No, it doesn't hurt at all. Are you even on it?
Oh yeah.
No, I'm serious. I don't really feel that.
Okay, I'm gonna go deeper. What about now?
I feel it, but it doesn't hurt really.
Oh, we're fine. Okay, we're almost done.
That's okay. It doesn't
That's
hurt.
perfect. Okay.
It's okay.
How does it feel now?
Tender.
That's scar tissue. Feel this?
Yeah, it's bad.
That's like I don't know if you can see my hand. Okay. Here.
Is that the biceps tendon?
Yeah. You see the vibrating here? Okay. It's not as big as the one you
Yes.
have,
He's got a
But
bigger
it's-
one.
it's yeah, like your hand was like going over it. It's a little bit tinier. Okay.
Oh, there he's gonna use it.
Get the big gun? Is he getting a big gun?
Okay, close your eyes. Okay, so we're doing this, and you guys gonna see the redness, and can you see that? Is that too much?
It's a little tender.
Sorry. What about now?
Okay.
So you can see the rolling over the tightness here. Okay, and you feel the grinding.
Yeah, that's tender.
Hear it.
Okay,
Yeah, you can.
you can hear.
You can hear it.
You feel it here more. Okay, compared to
Both.
There's one here. Okay.
Tender.
So sorry. Okay. And we do the back one. This is much easier than this. So how we gotta do it? Let's lean forward a little bit. Too much? Relax. Okay. So remember the rules I told you?
Go.
Yeah, the protocols. So don't say it, but I'm doing it now. Okay. Oh. Okay.
Can you hear
You're
it?
using your hand a lot. Yeah, that's louder actually.
Saxophone, piano.
Oh, do you want to try it?
What's that?
Because you had the other tool.
Yeah, I'll bring those tomorrow and we'll
Yeah.
experiment with
Feel
them.
it? Feel that?
Feel the difference, yep. It's doing the
Feel-
same kind of thing. Same
Vibrating.
Yep.
It
Wow.
feels vibrating. Yeah.
You can see that.
You can see.
vibrate.
You can see actually the tool actually vibrating.
Yes.
Wow.
action. Yeah, the patient can feel it. It's granular.
Here, when I do it slowly,
Yep.
Oh, yeah.
and it's kind of like stop.
And that's not tender at all.
Yeah.
Oh.
Yep.
You maybe got used to it.
Maybe.
The patients
And
usually
here,
say it's
here,
not
here.
painful.
See that?
Yeah, yeah.
It's actually a good hurt.
Here, make sure it's not painful. Here you go.
No.
See that?
That's scar tissue right there.
That's the original issue. Like you said, it's pain here. Let's see if this is bad. Okay.
I take it this is cleaning the whole house right now?
Yeah,
Yeah,
we're
the whole
cleaning,
arm,
house
yeah.
cleaning.
Okay.
So that's what my client
So you see here.
Ah,
This is the area you said it was tender.
Yeah, it's definitely more tender where it's turning red.
Oh, yeah, you see. Here you go.
she has issues.
So you actually, like when you have the tool, you can feel it, and the colors actually will give you like a kind of
That's
That's a
vis-
roadmap
visual
to the worst
feedback.
areas.
Yeah.
Because you're not pushing harder on those areas. They're just, the blood's
Do
going.
it on yourself.
Yeah, no, but the blood's going, oh, here's where I need to be.
Hold
Is
it,
that what's
hold it, and
happening?
feel how much pressure.
Oh.
How much pressure?
It's a little bit of pressure to make it go.
But it's not like you really.
No, you're not hurting yourself to do it.
No.
So
Oh,
the tool just looks
Tender.
kind of
oh,
gnarly.
sorry. Okay. Okay, so may I get the towel, please?
Oh yeah, history of shoulder dislocations.
Oh, this one.
Both, and they dislocate anteriorly.
You put it back to place by yourself, or someone
Yeah,
did mobilization?
by myself. Every time I scratch my back, if I go like this,
You
I have to
dislocate
do.
Yeah,
it?
probably shouldn't do that.
I have to do a special thing like this
Oh
to
my-
get it
Yeah.
back into place.
Oh,
Both arms.
that's painful.
Was better than
Sorry
going
about
to
that.
ER, right?
Yeah.
Mm. Okay, so you said it was 5 in the back when you were holding the 4 pounds.
Still got it underneath back here.
Some lotion here. I thought
Thanks.
I will leave some memories. So when she gets home, he'll have this for me.
Oh,
Souvenir.
Thank you so much.
so nice.
Yeah.
Party favor.
Hmm. Don't throw it on anyone.
Oh, that looks better.
How much or feel it's gone?
It's very mild, and the areas that are being stressed are now further away from the area. So now I'm starting to feel it more like in here. You know, it's moving toward the spine where the other muscles are stabilizers, rather than the actual movers.
Sounds like a cure to me.
Well, let me do this quickly because you said you dislocated, you had fracture, you said, or
Yeah, second rib.
so now she starts to realize the other issue, like when we release area, her brain, instead of focusing on the most tight area, her brain start to compare, oh, this is start to feel loose. Why this side is not feeling the same like this? So she start to realize, like, oh, there's tightness here. I'm gonna do this area, and is that too much?
No, that's fine.
So that's a whole quadrant we're talking
Yes. I will like do it if it's not in the camera, the whole thing, because like
I've never used it.
from history, that's in the back of my head. That's what I'm gonna do. You know, so the patient tell you from the history, oh, she had this injury, this
But
injury,
I've never used them.
so she had several injuries. So that's she's telling you.
Yeah.
Okay, let me know if it's true. Oh,
I
this is a
will.
big one.
Always.
Typical. And I'm just gonna rest here for a while. Make sure it's not too much, okay?
I want to see the look on her
And
face.
you see my body mechanics?
That hurts.
Sorry.
It's okay.
Do not injure yourself.
Yeah, so try help patient and don't hurt yourself.
Are you doing like a thrusting?
We'll talk about this afterwards.
It's a little tender.
Sorry. And I'm not really doing much here. But you feel this one, yeah? What about now?
Less.
Okay. But is it still tender?
It's fine.
Mm-hmm.
Can this go back in there? Is it the same? Okay.
Okay. All right, so let's try it again now. And tell me how that feels.
It's a girl. Look out.
How many times she did it so far?
A little something in
How
there.
much? From 0 to 10?
In the areas where it hurt before, I'd say 0.
Okay.
Yeah.
Okay, what,
Okay.
and what happened there now?
Just a little something here, but I'm not
Is it
gonna make
pain
you
or
do
is
it.
that, what is it?
Yeah, it's pain.
Serratus anterior.
Subscapularis, serratus anterior.
Oh, relax.
I can't. That one's really good.
That's
That's a goodie.
Relax, okay. Think about something you like to do. What do you like to do?
Everything.
All right, awesome.
Goat yoga. She likes doing yoga with goats.
Oh, wow, that's awesome.
Is that how you broke your shoulder?
No, that was a horse.
Oh, wow.
Horse yoga, that's a different story.
So the goats balance on your back.
It helps you work your core, and it's really about fun and connecting to nature and giggling and petting goats. They're very cool
Do the
animals.
goats ever have a movement in that situation.
Constant, yeah.
Oh,
When they
man.
like you, they introduce themselves by pooping and peeing near you. You're supposed to put your nose in the air and
They're on
scream.
top of you, right?
It has happened.
Wear a waterproof
They're
clothes.
still giving guns, bro.
Waterproof clothes.
It's good stuff. The poop is very benign. It's like
It's
we
organic.
call them chocolate chips.
No GMO.
They don't really smell unless they eat dog food, and then they're hideous. But they just eat hay; they don't smell at all. So that doesn't hurt at all. So I don't know if you're going away from the main
I
area,
know I
right?
tried something different.
Okay, that was a good one.
So I can. Okay, let's try it now.
Okay.
Okay. Why when you do that, everybody goes far away?
They don't trust. They don't trust me. That's yeah.
That's like job number 7.
That's a good. That's a good. That's a good.
It's true.
That's a good outcome measure. Everybody
Yeah.
backs up about 3 feet further each time.
I want
Feels
to
good. Like I don't think I could have done this without pain and just put it
And the
there.
elbow.
Yeah, better, way better than the elbow.
So, what do you think about the treatment, you clinicians? So,
I think it's good stuff.
thought?
I think there's definitely increased blood flow, and you can't go wrong with that.
What about the pain level?
Pain level is definitely decreased, for sure, and I think range of motion is better, and it'll be fun to see how this goes. So thank you very much,
Yeah,
Doc.
thank you so much.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.